Next, I would ask if the executive sponsor for the process design team for ED Copay would come up. That's Maria Duraz. Maria?
Presently, we collect copays in the medical centers, and we're at probably a 95 to 96 copay collection percentage average for all the copays for the medical centers. And we undertook, the A3 team undertook the possibility of collecting copays in the emergency room. And that's a little bit of a challenge, and they stepped up to the plate, and I'd like to introduce Jess and her team. Tell us how they do it.
So I guess I'm the only one up here. That's right. Lori would have been here too, but she's doing ACLS over at Griswold, and I'm sure that's more important than this and probably more fun. I don't know about that. Okay, so we did have quite a big team for this. We had Lori from the nursing department. Bob helped us out. Donna from switchboard. Sarah helped out with any if we had any questions around compliance. Gianfranco, which is now my boss, was a part of this to help with the overnights and everything else. Kathy from IS was the one who got us all set up with the access in Meditech. Melissa was definitely helpful with trying to figure out the billing, and since this involves money, I'm sure she had to be a part of it. Ron, because of course collecting money in the emergency department can be kind of treacherous depending on what's going on. And we had Bob from materials for the bank bag, Pam from finance again helping with the money, and I had a lot of input from the nursing staff and my staff. So co-payments were currently accepted in the emergency room, and we were missing out on a huge opportunity to collect some money and also help some patients out with not getting a bill after the fact. And also it helped out with actually seeing the patients on the way out and getting some more information about them. And this was a brand new process, fresh. We didn't have any background information or anything. And we found out it cost somewhere between $30 to $35 to send out a bill. Bad debt for the month of May in 2013 included about 389 accounts out of the total 2,073 patients we saw. That's about 19%. And because of EMTALA regulations, which is the Emergency Medical Treatment and Labor Act, we couldn't technically ask patients for their insurance information prior to be seen by a nurse or a doctor. So this helped out because we saw them afterwards. Collection of co-payments were basically only from the patients who could pay. Patients who have certain insurances don't have co-payments. Patients who have 2 insurances don't have co-payments, so we had to set that up. Verification and updating of patient information in Meditech, that was also important because if someone was coming in with chest pain, obviously we wanted to get them back right away, so we couldn't always ask them all the information. We really didn't have a lot of initial scores for this, again, because it's a new process. And of course, we had the press gating scores at the time, which was 90% for the emergency room. We actually gained a lot of insight from an employee who works here and is also a registration clerk over at Mary Lane. She helped us get a general idea of how they do things, and we used that to benchmark for our ideas for the emergency room. This was an example of the action plan that I put together for how we were going to go through and get this process going. Very detailed, and as a lot of people know, I'm a little bit over-organized. This was updated every time something was finished, something needed to get edited, whatever. Updated it frequently, maybe once a week, I think. And then this is page 1 of the standard work. Again, I like a lot of detail. This has also made it a lot easier because a new staff coming in can actually read this straight from start to finish and know the process without, somebody having to walk them through it if they have a general idea of how Meditech works. We even use it for a little bit of re-education if something's going wrong. I think I've edited this about 5 times since I implemented it because things have been changing. So as you can see, our target for safety and quality was 50%. We were at 45%. But this number isn't completely accurate depending on how busy we are in the emergency room. I was noticing that we weren't keeping track of this when it was the busiest, because a lot of patients, we would see them on the way out and not get a chance to check off that we had talked to them. So this might actually be a little bit higher. I'm still working on a way to make it a little easier to track this. Participation, pretty much every single employee in the nursing staff and the registration staff have had complete participation in trying to get the patients back to see the registration staff on the way out to either pay their co-payment or to finish their information. Customer satisfaction, we're still up over 90.4%, and this is only for the registration staff. It doesn't also include the nursing staff. I've taken those numbers out of the press gang just to show how the patients are satisfied with what they're going through on the way out. And as you can see, I think by today, we're actually over $30,000 since we started this 4 months ago with collection of co-payments in the emergency room.
Wow.
So this pretty much just summarizes everything I just told you. We've collected almost $30,000. 45% of the patients are being seen. And a lot of patients are actually happy to take care of their co-payment on the way out. They don't want to see something 3 weeks, a month later, whenever it goes out, about a co-payment and more money they have to spend. So they would rather get rid of this right at the time of the visit. There are still a few patients who are leaving without seeing us. We're working on that. Again, it's a process. It's been 4 months. We're still going to keep editing this as time goes on. The biggest insight was when the first 2 days of the process, patients were just leaving. They weren't stopping and seeing us. So a few employees had the idea of creating a card to give to the patient. And when the nurses are discharging the patient in the room, they would hand them this card and ask them to come see us on the way out. And we actually saw almost every patient the first 2 weeks. They were all walking right by, handing us the card, having a conversation, paying their co-payment, and leaving. This is more respectful to the people because it allows the patients to settle their accounts a lot sooner. And it decreases the amount of paperwork for the billing department. I've heard from a few staff in the billing department that it's gone great. They're happy with it, and it's relieved a little bit of the headache in trying to get the bills out to get to the patients for the co-payments. Biggest challenge is still having patients stop and see us on the way out and having everybody on the same page because we are 24 hours, so it's hard to get the overnights to do the same thing as the day shift and the evening shift. And there's also a difference in volume between all of those. And lastly, just keeping up with teamwork with the nursing staff and the registration staff, talking to them daily, weekly, and finding out how we can make this better.
Questions for Jessica?
Just
co-design project.
when a patient comes to the emergency room and gets seen, are you in the background looking up what their co-payment is so that when they hit the window, you tell them you have it right there. It's not a matter of having to do more work when they come to the window.
Right. When they first come in, we get all their information aside from the insurance because we can't ask for that. If they've been here before, we look it up in the computer, and Nihin will tell us what their co-payment amount is. If we can't find it on there, we'll look for an old insurance card. Sometimes that has some pretty accurate information. If we can't find anything, we'll ask them for their insurance card on the way out and look at that.
So a lot of times it's not they don't have to stop and wait for you to do stuff that's already for them.
Most patients are probably only up there for 2-3 minutes, depending if we have to scan an insurance card because we didn't get it earlier.
Great.
Anyone else?
I do. Hi, Jess.
Hi.
Do you find that patients sometimes get angry? Like they're not feeling well, they're really sick, and you're stopping them and asking them for money?
I think I've seen personally, since we started this, maybe 1 or 2 like that. But a lot of patients are actually happy when they're on their way out. We've made them feel better. We've gotten them back on the right track. So they're more apt to pay their bill when they're happier too. So that's also a big help. You know, think about it. I should sure take my money. Make me feel better. But, you know, so that not too many people are actually upset when they're leaving.
So one more, the amount that you say you collected $28,500, but the actual savings would be that plus you don't have to send a bill out.
Yeah.
Is that in there?
I haven't actually gotten all that yet because I haven't gotten the exact numbers for how much it costs billing to send out the bills. I am working on trying to get that information together as well, and plus finding out how this is affecting bad debt, because it can affect a little bit because not a lot of patients who are paying their bill now were probably paying their bill back then too, just when they got it. But this could affect bad debt because a lot of patients are taking care of it up front, and it's helping with the cost of sending out the bills.